Hello again, everyone. I'm Dennis McCarthy with Upper Allegheny Health System and Olean General Hospital, welcoming you to Inside Olean General Hospital, our news and information program about our hospital, the services that it provides to the community. Today we're really not in the hospital. We're in the Gundlah Dental Center on the campus of Olean General. And with us today are Dr. David Capuccio and Dr. Julie Strauss, dentists at the Gundlah Dental Center.
Thank you for having us.
Thank you.
This is a really wonderful place for the community. It's a terrific community asset. It's a very busy place. So we know we have, you call them operatories, I call them chairs, but they're 11, correct?
Okay.
Operatories at the Gundlah Dental Center. If we could take a moment to talk a little bit about what kind of work the dentists do here.
Okay. Well, here at the Gundlah Dental Center, we have a state-of-the-art facility. We offer a wide variety of dental procedures, anything between dental cleanings, deep cleanings, exams, extractions, fillings, composite and amalgam. We do root canals, crowns, bridges. We do partials, dentures, full extraction cases, and inserting dentures the same day. We have an oral surgeon here as well. That goes over to the OR and does cases over there as well.
Sounds like a complete set of services that we have here.
Yes, absolutely.
Dental health, oral health is very, very important. And we know, or at least you know, and maybe we could talk a little bit about the importance of oral health and when people should really get started in keeping your mouth healthy.
Well, as soon as you are aware or a child's parents are aware is really when you should start taking care of your mouth and your teeth. There are numerous studies and papers about the connection between systemic health and oral health, links with diabetes and blood disorders, and heart disease, et cetera, et cetera. So, when their first teeth come in, about 1 year old is when parents should bring their child in. And as soon as you are able to and want to take an initiative to take care of your teeth is a perfect time to come in and do so. So
pretty young to get started, but
yep.
not too, I'd say not young enough, but get started early and get the habits going. Because oral health is really an impact on your whole body, isn't it? You were saying heart disease, loss of time, I guess, poor oral health and the other things from work and can really impact your lifestyle if people don't take care of their teeth. That's correct. The whole idea of keeping your it's habitual, isn't it? It has to be a habit. It's not something that you do once in a while. You have to take care every day.
Every day. We recommend brush twice a day, if not more. Floss at least once a day, if not more. I mean, really after you eat, you should be doing something. You
should have a little packet of floss in your pocket, right?
Exactly.
Most people do that. Toothbrushes are confusing. We were talking earlier about it. There are so many different kinds of toothbrushes out there, so many different kinds of toothpastes, mouthwashes. What do you say to people when it comes to the kinds of a toothbrush, for instance?
Well, my advice is do what's the best for you. I'm not going to tell somebody to use an electronic toothbrush if they've been effectively brushing with a manual toothbrush for years. The same thing goes for the other case. But we want people to use soft bristled toothbrushes if they're going to use a manual brush. And if you're going to use an electronic toothbrush, you should talk to a dentist or a hygienist about the proper way to use those so that you can use them effectively.
People use them improperly?
Absolutely. And the biggest thing is making sure that you're using them all in conjunction with each other. Don't just use one or the other. Make sure that you use the toothbrush, floss, and use a mouth rinse. Don't just use
altogether
a mouth rinse.
Again, we were talking a little bit earlier about tooth enamel and sensitive teeth. Mm-hmm. And what causes this in terms of, people become sensitive and all of a sudden they find that their mouth either hurts or they have a funny sensitivity that you can feel. What causes it and what do you do about it?
Well, the enamel of the teeth, the outer layer of the teeth, is what protects your teeth. When that either wears away, breaks away, or your gums recede away from the tooth, you can have either dentin or cementum, the root structure of the tooth, exposed. And that's kind of like a portal into the nerve of the tooth, which was going to cause that sensitivity that you're referring to.
Right.
So, whenever those things happen, patients will complain of sensitivity, and that's where we come in and kind of recommend the best treatment option.
So, toothpaste with I call it. I'm marketing something here, and I shouldn't. Sensodyne, for instance, toothpaste is like, they work, they help.
Sometimes it depends on the case and the patient. And if you're really having sensitive teeth, definitely come in and get an exam and some X-rays, and so we can see what's going on.
We were talking about gum disease, and I was asking the difference between gingivitis. There are different gingivitis and periodontal disease. So help me sort that out a little bit.
Okay, well, gingivitis is kind of the early stage of periodontal disease or periodontitis. Gingivitis is just a term that means the swelling or inflammation of the gums. You might notice that your gums bleed or they're puffy or inflamed. If you have periodontal disease or periodontitis, you'll notice that maybe your teeth feel like they're longer. Maybe the roots are exposed and sensitive. Maybe you notice a bad smell or something like that. But periodontitis is the advanced stage of gum disease where you lose the bone and the tissues that support the teeth.
So that basically, they separate from the they begin to pull back?
You get a lot of bone. The two things that hold the teeth in place are the gums, the bone. So once you start losing that bone, those teeth can become mobile. Sometimes we can correct it if we catch it early enough. We could do some deep cleaning. Sometimes we can send you to a periodontist, and sometimes the end result is taking the teeth out and getting some either partials or dentures.
What's a root canal? Because I keep hearing, people that have them, and you have a root canal, and what does it actually do? And a lot of people say, "Oh my gosh, it's a really, really."
Root canal is a great way to save your tooth. There's different ways why you would need a root canal. A lot of times, you have an infection, or you might have had a large restoration on your tooth and causing the tooth, the nerve in the tooth to die. So what we do is we just put a small hole through the top portion of the tooth, and we remove the actual nerves out of the tooth, and we replace it so you don't able to get an infection in there. We clean it out, we do some irrigation and stuff, and then after root canal is complete, then you want to put a crown over the top of it.
Okay, and that's basically saving the tooth.
That's saving the tooth, right.
Bacteria. I was doing a little reading before the show, and good bacteria, bad bacteria. Bacteria is in the mouth a lot from a lot of different sources, but is it a good thing or a bad thing?
Depends.
Go ahead.
I would say it's a good thing.
Yeah.
You talk about kids having exposure to bacteria outside and getting their immune systems built up. The same thing goes for your mouth and your overall health. If you're taking antibiotics all the time, you're going to disrupt the oral flora or the gastrointestinal flora, and you could get really sick. Obviously, certain bacteria cause disease, and that's why we prescribe specific antibiotics and treat dental disease. But to answer your question, I think it's important to keep that in balance.
Do you agree?
Absolutely.
Okay. The other thing that I was looking at before we came in is this issue of dry mouth and the role of saliva. And everyone has saliva except if you have dry, but saliva plays an important role in health, doesn't it?
Absolutely. Absolutely.
It washes. It's actually your own mouthwash, isn't it? To a certain extent.
So with the polypharmacy is what it's called, where patients are taking multiple drugs.
Yeah.
Many drugs have a common side effect, which is xerostomia, which is the fancy word for dry mouth. And you see patients who are taking a lot of medications who will come in and say, "Hey, I never had a cavity in 20 years, and now all of a sudden I've got 14, 20 cavities. What's going on?" And the answer is
their medications.
That they're not being protected by their saliva anymore.
Right.
Okay. And the underlying cause is the medications. But as dentists, we're not going to tell somebody that they can't take their high blood pressure medicine or their mental health medicine, for instance. So that's a kind of an uphill battle for the dentists, but it's something we need to deal with. But
Is there anything that can be done about just the idea of dry mouth? You wake up in the morning,
I mean, there's medications that we can prescribe. There's over-the-counter medications or mouth rinses or toothpaste. I mean, they've come out with a lot of things. And I would say that would be, it depends on the patient, how severe, of what I would prescribe.
Okay, that's fair enough. We've covered a lot, and maybe we bounced around a little bit here, but is there anything that we should be talking about and that we should know about, or things that you would like to mention to the public?
Well, I think number one is definitely come in and get an exam. You should be in here getting a cleaning every 6 months. If you have gum disease, it might be more frequently. And just make sure, and we can help you and guide you and recommend everything that we would recommend for your situation.
The other thing I would add is, especially if you're anxious, if you haven't been in a long time, is that if it's myself or Dr. Strauss or anybody in the community, we're really here to help and serve the patients. So, it's not, we're not trying to hurt you. We're not trying to put you through something that you don't want to go through. We really are just concerned with your health, your oral health, and we just want to help out our patients.
That's great. And again, the center's been here a long time. We got a great staff.
Absolutely.
Staff come here and they like to work here, and you two certainly are a big part of why people like to come to the Gundlah Dental Center. So thank you for being with us today. And that'll be about it for today's show. For more information, check out the phone number on your screen here. And for Olean General Hospital and Upper Allegheny Health System, I'm Dennis McCarthy. Have a great day.